Good Friday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to the entire team at Knox County Schools. All of the team members at Knox County Schools play a critical role in our community, and like all of us, they are navigating a way forward in these uncertain times. We want to spend a few minutes talking about our relationship with the Knox County Schools. Even before the pandemic, we worked with Knox County Schools all of the time. From data collection for our Youth Behavior Risk Survey, to health promotion through our NEAT program, and to assistance with our yearly flu miss program. This list goes on and on. And when it comes to infectious diseases, we have plenty of experience working alongside our partners at the schools. When a case of an infectious disease is identified, we work closely and immediately with the schools to take a surgical approach in determining the next steps. That could be anything from sending the sick individual home, to closing a classroom, to closing an entire school. The response depends on the situation. It's not like a light switch where it's either on or it's off, or open or closed. This translates into how we are working with the schools today surrounding COVID-19. We can't predict the future, and this is a virus we only have 5 months of experience with. But we do have years and years of experience working alongside the schools and a proven history of collaborating in the midst of public health issues or threats. Ultimately, the school's plan and their day-to-day operations are for them to decide. But we will continue to advise the schools during this pandemic. We will continue to look at the situation, considering the full picture of the benefits and risks regarding all options. Now I'll move on to the local situation. We have 2,839 confirmed cases of COVID-19 in Knox County. Additionally, we have 128 probable cases. 1,246 of our cases have recovered, giving us 1,571 active cases. 184 individuals have been hospitalized at some point in their illness. Currently, there are 44 Knox County residents hospitalized for COVID. We are saddened to report an additional death due to complications from COVID-19, bringing our total to 22. Our thoughts and prayers over the loved ones of these individuals as they navigate this difficult time. As a reminder, the next Board of Health meeting is Wednesday, July 29th at 5 p.m. The public can view the meeting live on Knox County's YouTube channel or the Knox County website. During this week's Board of Health meeting, the topic of social gatherings was discussed. The reason why the conversation surrounded the topic of dinner parties, baby showers, birthday parties, is because it is gatherings like these where we are seeing our cases grow. I want to start by saying we want you to live your life and celebrate these big moments like, excuse me, like a birthday party or a gender reveal. But we ask that you do it safely. Just because the group you're hanging out with in your, I'm so sorry, in your kitchen or your backyard is your family or friends. Does Charity, can you?
Yeah. Yeah.
Sorry. I'm going to let Charity take it from here. Sorry, everybody.
Hello. All right. Get where we are on our hang out. I know I've just got to find it where it's on here. Sorry, everybody. Okay, just because the group you're hanging out with in your kitchen or your backyard is your family or friends doesn't mean that they aren't at risk of spreading the virus to you or you to them. That's why the 5 core actions are so critical. These actions aren't just meant for when you go to the grocery or run some errands. They're meant for every situation you find yourself in. For example, let's say you have a group over for a barbecue. That's great. But you must remember the 5 core actions in that setting. If the people coming to your house aren't able to maintain at least 6 feet of distance, they should wear a mask. And as Dr. Shamia mentioned in a previous Board of Health meeting, life as we are accustomed to doesn't often lend itself to easily fit that 6 foot minimum. It's easy to break the imaginary line, especially if they're close friends or extended family and we let our guard down. But that is just the opportunity that the virus needs to spread. It all sounds extremely basic, but we also know it's much easier said than done. We continue to ask everyone to remember the 5 core actions, whether you're going out shopping or just going to a friend's house. Wearing a mask while hanging out with friends can feel a little strange, and we understand that. We feel the same way. But implementing these actions into every aspect of your life today, by doing that today, the sooner we won't have to do it anymore. And now we'll open it up for questions, and Dr. Buchanan's back, so I'm going to slide out.
All right. If you have any questions, you know the drill. If you can go ahead and type them into the chat feature, and please type in your name and the media outlet in which you are affiliated with. The first question we have is from Elise with WBIR. She writes, we've seen a jump in cases among people 0 to 10 years old. What do you think is causing that jump? Is it any concern? And how does that impact school and young children who realistically cannot keep a mask on all day?
So that group is one of our smaller groups. So any increase in that group is going to look large. We don't have there are no trends that we're seeing among that group at all. And, Knox County schools will work hard to keep those children safe when they return to school.
Elise from WBR has a follow-up question is, are you concerned about students on the school bus, especially at the beginning of the year when they are typically extra crowded?
We're certainly concerned about students on the school bus, on the school grounds, in the schoolroom, anywhere they are, because we're concerned about our children, and we're concerned about the bus drivers and the teachers and the folks who keep the schools clean and provide food and do other things at school. And the school's plan is based on the 5 core principles of social distancing and wearing masks and cleaning and washing your hands and staying home if you're sick. And they do have guidelines for buses and what to do on the buses. Following those guidelines will reduce risk. It won't eliminate the risk, but certainly will reduce risk for everybody on the bus.
Question from Laura with WATE. Do you have any details available for the most recent deaths reported?
87-year-old male.
From Vincent with the Sentinel. Why did the Board of Health not address the 2 reports that came out of the federal government this week? Those reports recommended more stringent guidelines for COVID-19 prevention, and none of those guidelines were discussed in the meeting.
That information was sent to the Board of Health. It was up to them to bring those topics up.
From Laura with WATE, has there been any luck identifying an alternative site for testing on hot days?
We continue to work on that, and it won't just be for hot days. It'll be what we would like to do is permanently move to a different location, so we're not moving around, because that's hard on our staff and confusing for everybody. So we want to find one place we can stay for a long time. So we're working out the details, and as we all know, the details can sometimes slow things down.
From Robert with WBLT, what is your message to COVID-19 patients after their 14-day quarantine? Should they retest after? And is it possible that the virus lasts longer than 14 days and it could still test positive?
Well, what we know about the virus, based on data from lots of other places, is it's a 10-day isolation period from onset of illness or from the day you got tested if you're asymptomatic. So once those 10 days have elapsed and the person no longer has COVID symptoms for at least 72 hours, so that might be after 10 days, or just changed this week to 24, for at least 24 hours, they are considered no longer contagious. We do not see that they pass the disease to others after that period. What we do see is, like many other viruses, the virus hangs out in their system. The virus can no longer make other people sick, so it's dead virus. It isn't making them sick anymore either. It can't pass it to anybody, but it can be picked up on a test. So we don't recommend repeat testing, because you can actually shed that virus that doesn't make anybody sick, isn't making you sick, for several weeks to months for some people. So that's really not advised to keep testing repeatedly after you've recovered from COVID-19 or any other illness.
From Elise with WBIR, Knoxville Mayor India Kincannon released a video on social media today saying KCHD and the Board of Health need to do more to stop the spread of the virus in our community. What is your reaction to that? Mayor
Kincannon has her thoughts and is entitled to her thoughts about what the board should do. She certainly can share those thoughts with the public or with the board whenever she would like.
Elisa's follow-up question is, what more can KCHD do and what limits do you have?
Well, the board is the deciding body on what we advise or what policies we can put in place for the community. As far as what KCHD can do, excuse me, we're doing about everything we can do. We're testing, we're teaching, we're educating, we're holding these press briefings. It's up to the board to set policy for the community, and they'll choose to set those policies based on the information we bring, their expertise, and what they think is best for our community.
From Laura with WATE, has KCHD received the CARES Act money from the state just yet, and how will that be used?
We have not received any CARES Act money from the state yet, and how that will be used will depend on how they tell us we can use it.
Any other questions? Please go ahead and submit them. From Vincent with the Sentinel, can you confirm whether you have been coordinating with volunteer groups like East Tennessee Harm Reduction to provide relief to local houseless people during the pandemic?
So our EOC there's a kind of a separate group that's working on that. So we are not directly coordinating with them or working with them. We asked the EOC to help us with that, the Emergency Operations Center. And that group has pulled in several different organizations. I don't know who all of them are, to serve folks who have a need, whether it's a family or somebody who's in quarantine who needs food or housing or other things. And actually, my understanding is it's really going pretty well, and they've pulled a lot of community partners into that group, and we're really grateful for the work that they're doing, because we really would be challenged to be able to do that as well as they're doing it.
From Robert with WBLT, he says this is a follow-up to his question he asked a couple minutes ago. Is it possible to still experience symptoms after a 10-day isolation? And what do you do at that point?
Yeah, so people can continue to have symptoms like anything else. Like if you've ever had the flu, you cough for weeks after you get over the flu. So people will continue to have some symptoms, like maybe a cough or maybe some fatigue, but those things are common. What you want to see is improvement of your symptoms, your overall symptoms, fever going down, just overall feeling better. You may not feel 100% for several days, but you're no longer infectious.
From Alan with Inside of Knoxville, will you report any cases among students, teachers, etc.? Will you report them by specific school?
We'll report them in the general group of reporting that we do every day, not by school at all.
From Vincent with the Sentinel, in regards to his previous question about the coordination with volunteer groups, he asks if you can direct him to the correct person to ask.
We'll follow up with you after this.
From Bob Morgan with Knoxville Liberty Press, have you or the Board of Health been advised or received information from Protect My Care organization of medical professionals in regards to public policy?
I'm not aware of any information from that group.
Any other questions? Go ahead and type them into that chat feature now. All right, not seeing any other questions come in. So thank you all for joining us, and we will be back with you on Monday afternoon. Have a good rest of your day and a safe weekend.